Welcome in, everyone. Today's deep dive is all about ADHD. And the source material is honestly pretty fascinating. It's a transcript from this podcast called Stokit.new.
Stukik.new.
Yeah, so
Right.
Stokit.new. And get this, it's not a typical interview format or anything. It's a conversation between the host, Mike, and an AI.
An AI. Wow, that's really unique.
Isn't that cool? I thought that was such an interesting approach because you're really getting like this deep dive into the internal world of someone with ADHD.
It's like getting a window into their thought process.
Exactly. And, you've probably heard some of the things people say about ADHD, like it's overdiagnosed or just a label for kids who can't sit still.
Oh, yeah, for sure.
Right. Well, this transcript really tackles those perceptions head on. It challenges some of those assumptions.
I'm interested to hear more about that. So are we ready to jump in and explore this?
Let's do it. But first, let's start with the basics. What exactly is ADHD?
Well, ADHD stands for Attention Deficit Hyperactivity Disorder. Essentially, it's about how the brain is wired, particularly the parts that deal with attention, impulse control, and energy levels. All those executive functions. They're like the control center of our brains, helping us plan, organize, and stay focused.
So it's not just about being lazy or lacking willpower. It's about understanding that the brain's control center might be working a bit differently.
Exactly. It's not a character flaw. It's a neurological difference. And the transcript emphasizes this point really strongly.
That makes a lot of sense. Now, this brings up another big question. What actually causes these neurological differences? I know the transcript mentioned genetics, environment, even stuff that can happen during pregnancy.
Right. And they all play a role. The host, Mike, asked the AI about this specifically. And the AI used this really cool analogy. It said that genes are like the blueprint for a house, but the environment is like the construction crew that builds it. So you might have a genetic predisposition to ADHD, but how it actually develops depends on things like prenatal care, exposure to toxins, even early childhood experiences.
Wow. That's a really clear way to explain it. So it's this nature-nurture interaction that ultimately shapes how ADHD manifests.
Yeah, exactly.
Okay, so we've covered what ADHD is and what might contribute to it. But let's get to the real-world stuff. What does ADHD actually look like? How would someone know if they or someone they know might have it?
Well, recognizing ADHD can be tricky because it's not always obvious and it can show up differently in everyone. But generally, it comes down to two main categories of symptoms: inattention and hyperactivity impulsivity. And it's not just about being a bit forgetful or fidgety.
Right, like I lose my keys sometimes, but that doesn't mean I have ADHD.
Exactly. It's about the frequency, the intensity, and the impact of these symptoms.
So what are some more specific examples from the transcript that might help us understand these symptoms better?
Okay, so for inattention, the AI partner used this really vivid description. It said, imagine trying to read a book while a movie is playing in your head. It's not just about external distractions. It's about this constant internal whirlwind of thoughts and ideas competing for attention.
Wow, that really paints a picture. It makes you appreciate how challenging it can be to focus when you're dealing with that kind of internal noise.
And for hyperactivity, it's not always about bouncing off the walls energy. Sometimes it's more internal, like a mind that's constantly racing, going a mile a minute.
So even if someone appears calm on the outside, their internal engine is always revving.
Exactly.
One thing that surprised me while reading this was learning that there are different types of ADHD. I always thought it was just one thing.
Yeah, that's a common misunderstanding. The AI actually broke it down really well. It explained that there's inattentive type, hyperactive impulsive type, and then combined type.
Huh. So there are these different...
That's like different flavors of the same ice cream.
Yeah, gotcha.
Inattentive type might be someone who struggles to stay organized, gets easily distracted, has trouble following through on tasks. Hyperactive impulsive type might be someone who can't seem to sit still, interrupts others a lot, acts impulsively. And then combined type, well, it's a mix of both.
So it's more like a spectrum than a set of rigid categories.
Exactly. ADHD can present differently depending on a bunch of factors: age, environment, even the time of day.
Okay. So to recap, we've defined ADHD, explored some potential causes, and talked about the different types. And you've shared some great insights and examples from that Stokit.new transcript to illustrate all these points.
Yeah, and it's just the beginning.
Yeah.
There's so much more to discuss about how ADHD impacts people's lives, especially as they get older.
Exactly. So for our listeners, stay tuned because in part 2, we're going to delve into those adult challenges, the unique strengths that often come with ADHD, and the different options for diagnosis and treatment. It's going to be a fascinating continuation of this deep dive.
So, as we move on to talking about adults with ADHD, something from that Stukig.new transcript really stuck with me.
Oh.
Mike, the host, asked the AI, what's the biggest misconception about ADHD?
That's a good question. What'd it say?
Well, the AI's answer was fascinating. It said the biggest misconception is that ADHD is a childhood disorder, that people just grow out of it.
Oh, wow.
But in reality, ADHD often continues into adulthood, even if the symptoms change or become less obvious.
Yeah, that makes sense. I mean, our brains don't just suddenly rewire themselves when we turn 18.
Right. But the problem is that ADHD can look different in adults.
Oh.
So it often gets overlooked or misdiagnosed.
And that means a lot of adults could be struggling without even knowing why.
Exactly.
So what are some of those challenges that adults with ADHD might run into?
Well, the transcript brought up a few key things. One is time management and organization. All the demands of adult life, work deadlines, bills, appointments. It's like a constant juggling act. And for someone with ADHD, those executive function challenges can make it really hard to stay on top of it all.
Yeah, it's like their internal clock is running on a different schedule.
Exactly. And then there's emotional regulation. The Stogieg.new conversation talked about how ADHD can make people more sensitive emotionally, more impulsive too.
So they might have bigger reactions to stress or frustration.
Yeah, exactly. And then there's the social side of things. Adults with ADHD might have trouble with things like interrupting in conversations or picking up on social cues. Even maintaining long-term relationships can be difficult because of impulsive behaviors.
That's interesting. I've always heard about the challenges, but the AI in the Stukig.new podcast kept talking about the strengths of ADHD. Could it be that those same traits that cause problems can also be advantages?
That's a really important point, and it's exactly what the transcript emphasizes. ADHD is a different way of thinking and experiencing the world, and that comes with both challenges, AD strengths. Remember, the brain is wired differently.
So what are some of those strengths that we might miss?
Well, one of the big ones is hyperfocus. You know how sometimes people with ADHD seem easily distracted?
Right.
When something really grabs their interest, they can get into this incredible state of hyperfocus, blocking out all distractions and just getting completely absorbed in the task.
Like a laser focus.
Exactly. And then there's creativity. The AI pointed out that because people with ADHD often think outside the box and make connections that others don't, they can be super innovative and come up with really original ideas.
So instead of seeing it as a limitation, it's more like a different kind of creative potential.
Exactly. And don't forget about resilience. Living with ADHD often means facing a lot of challenges and setbacks. So people with ADHD develop this amazing ability to adapt and bounce back, to keep going even when things are tough.
That's a powerful strength to have for sure.
Absolutely. Yeah. So while it's important to understand the challenges of ADHD, it's also crucial to recognize these strengths and create environments where they can thrive.
Did the transcript have any examples of how these strengths can play out in real life?
It did. Mike asked the AI about famous people with ADHD, and the AI brought up some great examples. Entrepreneurs like Richard Branson, who's talked openly about his ADHD and how it helped him succeed. Athletes like Simone Biles, who's used her ADHD to her advantage in gymnastics. Artists like Salvador Dali, whose unique way of seeing the world led to his incredible surrealist paintings.
It's like their ADHD became this driving force that pushed them to excel.
Exactly. It really challenges the idea that ADHD is a barrier to success. It shows how understanding and harnessing its power can lead to amazing things.
This is all so fascinating. It's really changing how I think about ADHD. Okay, so let's say someone listening to this is starting to recognize some of these traits and challenges in themselves or someone they know. What's the next step? How do you even know for sure if you have ADHD?
That's where diagnosis comes in. And the Stogieg.new transcript actually gives a really helpful overview of this whole process. Mike, the host, was curious about this himself, so we asked the AI, how would someone even get diagnosed with ADHD?
What'd it say?
Well, first of all, it stressed that it's important to seek professional help. Self-diagnosis can be misleading, so it's essential to talk to a qualified healthcare professional. They'll typically do a thorough assessment.
What does that assessment usually involve?
Usually it starts with gathering a detailed history, asking about your childhood, your family history, any difficulties you faced in school or at work, your current symptoms. They might also use standardized questionnaires or rating scales to really get a sense of your symptoms across different environments.
So it's not just about what you're experiencing, but how those symptoms affect different areas of your life.
Exactly. And because ADHD can have similar symptoms to other things like anxiety or depression, the evaluation will probably involve ruling those possibilities out too. like a detective trying to put all the pieces together.
Okay, so let's say someone goes through this process and gets diagnosed with ADHD. What's next?
That's where treatment comes in. And it's very individualized, meaning what works for one person might not work for another.
So there's no one-size-fits-all solution.
Nope. The transcript talks about a few common treatment options. One is medication, which can be really helpful for managing symptoms like inattention and impulsivity. Mike specifically asked about the different types of medication.
Yeah, I remember reading about stimulants and non-stimulants. What's the difference between those?
So stimulants are the most common medications prescribed for ADHD. They basically boost certain neurotransmitters in the brain, mainly dopamine and norepinephrine, which help with attention focus and controlling impulses. It's like giving those executive functions a little boost.
So it helps the brain's control center work better?
Exactly. But stimulants aren't right for everyone, so non-stimulants are another option. They work a bit differently, mainly targeting norepinephrine, and they usually take a bit longer to kick in.
So it's about finding the medication that fits the individual's needs and what they prefer.
Right, but medication's only one part of the picture.
What about therapy? I know the transcript mentioned that too.
Yes. The Stokie.zq AI talked a lot about the value of behavioral therapy for ADHD. It's all about learning practical strategies to manage those tough symptoms. Think of it like a toolbox full of ADHD life hacks.
Okay, I like that. What kind of tools are we talking about?
Well, one of the most powerful tools is creating structure and routine. Remember how we talked about the internal clock being a bit off?
Yeah.
Well, having consistent routines helps to create an external clock.
So like regular sleep schedules, set work hours, plan breaks.
Exactly. It provides that external structure that can be so helpful for people with ADHD. And then there are organizational strategies, like breaking down big tasks into smaller, more manageable chunks, prioritizing to-do lists, using visual aids like calendars and reminders.
It's about finding ways to work with those executive function challenges.
Exactly. Therapy can also help with developing emotional regulation skills.
Yeah.
Like recognizing triggers, practicing mindfulness techniques, and finding healthy ways to cope with stress and frustration.
It sounds like therapy is about giving people the power to manage their ADHD instead of letting it manage them.
Exactly. It's about knowing your strengths, understanding your challenges, and developing strategies to navigate life more effectively.
This has been so eye-opening. We've talked about adult ADHD, the strengths it can bring, and the importance of diagnosis and treatment. But what about the bigger picture? How can we, as a society, create a more supportive environment for people with ADHD?
That's the perfect question to explore next. The Stukik.nimi transcript actually touched on some key areas where we can make a difference, from promoting understanding and empathy to challenging misconceptions and creating spaces where those different rhythms can thrive.
I can't wait to dig into that. So for our listeners, stay tuned for part 3, where we'll talk about practical steps we can all take to embrace neurodiversity and create a world where everyone, regardless of their brain wiring, can flourish. You know, as we wrap up this deep dive into ADHD, I can't stop thinking about that phrase from the Stukik.nimi transcript. Living with ADHD is like navigating life at a different rhythm.
It's so true. It really captures the essence of it.
Yeah, and it got me thinking, how can we as a society learn to embrace those different rhythms better? You know, create a more inclusive and supportive world for people with ADHD.
Well, the Stukik.nu conversation touched on that too. Mike asked the AI a really interesting question. What's the one thing you wish everyone understood about ADHD?
Yeah, that's a good one.
What did the AI say?
The AI said ADHD is not a deficit, it's a difference.
Hmm.
And I think that really gets to the heart of creating a more inclusive world. It's about shifting our perspective.
Yeah.
You know, moving away from seeing ADHD as something that needs fixing, and instead recognizing it as a different way of being that comes with its own strengths and challenges.
So it's about embracing neurodiversity.
Exactly. And a big part of that is education and awareness. The more we understand about ADHD, the better we can challenge those misconceptions and stereotypes that lead to stigma.
Right, because knowledge is power. If we can educate ourselves and others about what ADHD really is, we can start to break down those barriers and create a more understanding and accepting society. Absolutely. And along with education comes empathy. Trying to see the world from the perspective of someone with ADHD can make a huge difference.
Yeah. It's about realizing that those behaviors that might seem odd or frustrating to us could actually be coming from neurological differences, not intentional rudeness or laziness.
Exactly. Like someone with ADHD might interrupt during conversations, not because they're trying to be disrespectful, but because they struggle with impulse control. Or they might have trouble meeting deadlines, not because they're lazy, but because their internal sense of time works differently.
So instead of getting annoyed or judgmental, we can try to be more understanding and patient.
Exactly. And that goes for all kinds of relationships. Friends, family members, colleagues,
Right.
partners. The more empathy and flexibility we can practice, the stronger and more supportive those relationships can be.
Okay, so education and empathy are key. But what about concrete actions? What are some things we can do to support people with ADHD?
Well, in the workplace, for example, employers can make a big difference by creating more ADHD-friendly environments. Things like flexible work schedules, clear instructions, breaking down large tasks, minimizing distractions. Those can be super helpful.
It's about recognizing that what might seem like accommodations are actually just good practices that benefit everyone.
Right. And we can't forget about celebrating the strengths that people with ADHD bring to the table. Their creativity, their out-of-the-box thinking, their ability to hyper-focus on things that really interest them. Those are valuable assets to any team.
So it's about creating a culture where everyone feels valued and empowered to contribute their best work.
Exactly. And this applies to schools, too.
Yep.
Teachers can support students with ADHD by providing structured routines, clear expectations, visual aids, and opportunities for movement and breaks.
It's about recognizing that not all students learn in the same way and creating environments that cater to different learning styles.
Yeah. And for parents of children with ADHD, patience, understanding, and consistency are crucial. Creating predictable schedules, setting clear expectations, and using positive reinforcement can make a world of difference.
It's all about creating that sense of stability and predictability that can help kids with ADHD thrive.
Absolutely. And we should also remember the importance of self-care for people with ADHD, doing things that bring joy and relaxation, practicing mindfulness, seeking support from therapists or support groups. Those can all be really beneficial.
It's a journey, not a destination, and it takes ongoing effort and self-compassion.
For sure.
Well, this has been such an insightful look into ADHD. We've learned so much about its complexities, challenges, and the amazing strengths it can bring.
I agree. It's been a really fascinating exploration. And I hope our listeners are leaving with a sense of empowerment and inspiration to embrace neurodiversity and create positive change.
To all our listeners out there, thank you for joining us on this deep dive into ADHD. Remember, it's just one way of being human, a different rhythm in the symphony of life. Let's celebrate those differences and build a world where everyone can dance to their own beat.